So who should be going for clinical supervision?
Okay. We say, of course, trainees who are seeing patients. If we have trainees and they're seeing clients, then they should be supervised because clearly they are just starting and they need that support. There are those who would say once you're qualified, you don't need it. Well, yes and no. I think it helps to have a contact, however experienced you are. So when there is a need, you know whom to contact, whom to go to for to just go over the cases that you're finding a bit difficult, a bit challenging, I would say. So I would say everybody should have a supervisor. The issue is the frequency.
I was going to ask.
And if you're busy with clients, I suppose the busier you are, the more support you're going to need.
So I'm a busy, experienced therapist. What would your opinion be on the number of times, for example, I should go for clinical supervision, as opposed to a busy person who has just qualified maybe a year in?
It depends on the cases you're seeing. It depends on your workload. It depends how challenging your cases are. I can't exactly give it a number, once a week, twice a week. All I can say is it depends. It depends on the workload you're carrying. It depends how much stuff you're carrying.
From my personal perspective as a therapist, an experienced therapist, I also feel it's very useful for my development to be seeing somebody for clinical supervision, because you and I both know that as therapists you can get quite stuck in your ways sometimes. I like this technique, so I'm just going to ever use this technique and I'm not going to use that technique. This morning I was doing something about inner child. I was doing a small workshop on introducing the concept of the inner child, and I disclosed there to the group, when I first learned inner child, I hated it. It was taught to me on a very, person who taught it to me was fantastic, but I just didn't like it. And then I was going to, I met a client, I had a client, and at one level it was very obvious that inner child work would be needed. And my reticence to use inner child, it just wasn't me. I took that to my clinical supervisor, and we discussed it. And it gave me a different perspective, which allowed me to rethink and then go in. But also, as an experienced therapist, I now really like the idea that somebody can look at some of my stuff and say, actually, have you thought about it this way?
Yes, and encourage you to try these techniques. I think it's important that, you hear it time and time again. I remember somebody who I was supervising who wasn't keen on EMDR, and we discussed it, he and I realized that the difficulty he was having was to how to stick with the protocol. And we discussed it. I taught him how he can get around it, and went, like you with inner child, he went and came back saying he did the EMDR and he was keen on it. But I had to give him that encouragement and put him right about the protocol of the EMDR. I suppose if I hadn't done that, I would have said, oh, well, EMDR, there's other techniques to do. You don't have to do EMDR, and put him to another technique. But I didn't. I actually realized he kind of needed a bit of coaching, if you like, which supervisors sometimes have to be. You coach someone, you mentor someone, how to do the technique properly, and he liked it.